Dr. Margaret Harris is a spokesperson for the World Health Organization and a public health physician. Dr. Harris, good to have your company. 1 year ago, did you think we'd still be where we are 1 year later?
Good afternoon. I certainly hoped we would not have the huge number of cases and particularly the terrible, terrible death toll. What I also hoped, but the thing I did hope, but didn't necessarily believe would be possible, would be that we have the vaccines or the vaccines we have. And you just read out the numbers, which indicated that double the number of people who've developed COVID have already been vaccinated, which is quite extraordinary in just a few months.
I don't know if you heard our earlier report, but Denmark and Norway have halted the Oxford AstraZeneca vaccine as a temporary precaution. The world really isn't out of the woods yet.
Well, certainly those temporary halts, and I don't have enough information to give you a really detailed comment, but it is normal when you see any kind of events, you want to ensure that they are not linked to the vaccination. So it is normal to sometimes put a pause just to review that.
I just want your thoughts, while we have you, to talk about the side deals being done on the vaccine. Again, we reported this just a few moments ago. I wonder your views on the EU vaccine rollout and it pushing countries to break the wider EU arrangements for these side deals.
Well, I don't have any specifics on that, but we have made it very clear, and that's why we set up the worldwide arrangement, COVAX, which is open to all countries, rich or poor, doesn't matter where you're from, in order that we can roll these out in a very ordered way, starting with the most at-risk groups, the people most likely to get infected, and also the people who are exposed every day, because these are the healthcare and frontline workers who are out there fighting for us every day. So that's why we set up COVAX, and that's why we keep saying it's in every country's, every individual's interest to make sure that everyone is vaccinated in an orderly way at the same time around the world, so that we ensure that everyone's safe. Because as you know, until everyone's safe, no one's safe.
Is COVAX working?
It's certainly beginning to gain momentum. We've had rollouts now to more than 35 countries, and we're seeing it happen every day. And the critical thing is not just getting it to the countries, but part of COVAX is a lot of work on country readiness to ensure that countries, when they receive the vaccines, are actually able to use them and distribute them effectively. And we're seeing that happen.
What have we learned after a year of COVID-19, and how does this bode for the inevitable future pandemic or pandemics?
We've learned that this is a highly transmissible virus, and we've learned that the public health social measures work. So that is the testing, tracing, isolating. Now, the vaccine is a great tool, but it's part of that, and it must all be done together. We've also, of course, learned that in too many people, it can lead to severe disease, and that we need to manage that effectively, identify the people who are going into that severe form. We do now have treatments for that. We have anti-inflammatories, but we don't have a drug yet that can actually kill the virus itself. So we need to do a lot more work on that. But we have certainly seen in the countries where leaders have really galvanized their people, have explained clearly what's to be done and what needs to be done, they have been able to bring their outbreaks right down. And that was before they had access to any vaccines. So we know if we do it all, we can beat this, but it is very hard work.